for today. It's on oral health and tips for making a healthy smile. My name is Missy Schambro, and I help coordinate our health programming at Special Olympics Wisconsin. And I'm super fortunate to work with some great volunteer clinical directors for all of our healthy athlete disciplines. And today we have two of our Special Smiles healthy athlete discipline clinical directors with us to talk to you about your oral health and things you can be working on at home. While we're all at home a lot these days. So let's hone in those skills and get them even better when we do have time to work on them. So before I turn it over to them, I wanted to do a couple housekeeping just to let you guys know that we are recording this. And so we plan to have our live shows that we do, I believe, on our website at some point. So you can watch it again if you want to brush and floss along later. Another thing I want to point out is everyone is muted. So if you have a question, feel free to answer it in the chat. You can type it in there, not answer it, just type it in. We'll also unmute people when we ask questions later on in the presentation. And we can also take questions at the end. So you can always save them for that if you have them. But I think everyone that's in the waiting room is in. So we'll go ahead and get started. I'm just going to tell you about the goals today, and then we're going to let Sharri and Eileen take over the show. Really what we want to get out of today's session is that you learn about our Special Smiles program, because we would love to see you in person there when we're able to have them again. We really want you to be able to understand how your oral health is connected to your overall health. And we want to be able to demonstrate proper flossing and brushing techniques. Make sure you understand those and are going to use them at home. And then we just really want to encourage you to make sure you're brushing and flossing every day, doing the brushing twice a day at least, and seeing a local dentist when they're open, and answer any questions that you may have. So with that, I am going to turn it over to Sharri and Eileen to talk about our Special Smiles program. And I have a few photos and some of the slides right here.
Hi, everybody. I'm Sharri, and then Eileen should be right below me. As you can see with this slide that we have here, these are a number of volunteers and athletes who are participating in the Special Smiles events. It is offered at least 3 times, sometimes 4 times a year when we don't have COVID. And what we do is we do a very quick dental screening. It doesn't hurt. We look in your mouth. We let you know what we see. We provide oral hygiene instruction on how to brush and floss. And then we also provide fluoride treatments, and in some of the events we even provide mouth guards. A lot of people, I just wanted to touch base on the fluoride. A lot of people don't want the fluoride or are concerned about what it can do to their systemic health, and it has been found over the years to actually help prevent cavities and make your teeth stronger, which then results in you getting, not having to go to the dentist with a bad toothache. The research tells us that if you get fluoride 3 to 4 times a year, you're really doing your part in helping to prevent it. So I know there's sometimes when we do the screenings and we offer the fluoride and people refuse it, but it's actually something that's very beneficial for you. So just wanted to throw that out there if you're one of those that don't want it, to explain to you why it's good for you and that it doesn't hurt you in any way. Yeah, it's a little sticky, but it goes away by the next day. You're good to go. So let's see, we can go to the next slide, Miss. So let's talk about your oral health and your overall health. A lot of people don't realize that the bacteria that grows in your mouth circulates through your bloodstream and can affect other parts of your body. For example, I'm going to go with your brain. The bacteria that grows in your mouth causes inflammation. It can also release toxins, which then break down the blood vessels in not throughout your body, but especially in your brain, those blood vessels become thin, and then it can result in bleeding in your brain, called an aneurysm, which results in a stroke. So by keeping your mouth healthy, you're going to prevent a stroke, as well as if those blood vessels get weak, they can form clots, and you could end up with a heart attack. So the bacteria that grows in your mouth circulates through your bloodstream. It can affect your brain. It can affect your heart. It even can affect your lungs, that bacteria from your mouth. It has been found that people who have upper respiratory infections, they've done studies and they've cultured bacteria from their lungs and found that the bacteria that's developing pneumonia or bronchitis is actually the same bacteria that grows in your mouth. So again, the healthier your mouth, the healthier your body. The other thing we now know is if you are pregnant, there is a specific hormone that flourishes when you're pregnant. Well, this hormone, when you're pregnant, also allows a specific bacteria to grow in your mouth, and you get really swollen red gums. It's called pregnancy gingivitis, and it's directly related to the hormone increase, which then allows the specific bacteria that causes gum disease to flourish. The other big thing, and some of you may know this or may not, is diabetes. The bacteria that grows in your mouth, again, like I said earlier, causes inflammation. This inflammation process will actually increase your A1C levels for your diabetes. So the healthier you keep your mouth and keep the inflammation to a minimum, the better chances of your A1C levels to be decreased. There is some studies that also show if you have rheumatoid arthritis, how healthy is your mouth? There are current studies that are showing that an unhealthy mouth can increase your chances of getting rheumatoid arthritis. So something to think about if you should happen to have that. And then the other thing, of course, is if you don't go to the dentist on a regular basis, not only can these things be occurring, but by not getting screened or checked on a regular basis, you could end up with head and neck cancer. Those little lumps that aren't going away, or a sore in your mouth that isn't going away. Not saying it is cancer, but without getting it checked out, you just don't know. So it's really important to come on in and have those screenings done. And if you don't have a dentist, we'll do our best to get you a dentist. We're here to help you, and we want you to stay healthy. You're great athletes, and to be an even better athlete, you got to be healthy, not only in your body, but in your mouth as well. Because when you got a bad toothache, the last thing you want to do is compete. So we want to keep you healthy. Now I'm going to let Eileen take over. She's going to talk about a couple things.
Well, a couple of things. We're going to talk about brushing, and I'm hoping that, well, everybody's kind of stuck at home, that you're definitely keeping up with your brushing and your flossing. The most important thing with the brushing is to make sure you're getting, especially way in the back. I don't know if you can see my big teeth here. But to make sure that when you're brushing, you're also going way in the back here. Don't just brush these little front ones here, okay? You want to get all the way back around the corner. And you want to massage the gums as well. Not just the teeth. You want to gently massage that gum tissue, because sometimes when that plaque stays along the edge there, it makes your gums get real red and puffy, and then they're kind of sore. So if you gently massage those areas, keep that soft, yucky plaque stuff off of there, it's going to make your teeth and gums stay healthy. You want to make sure that you open wide, get all the way back to those molars, brush them well, get on the inside also. Again, circular motion there, coming up along these front teeth as well, right behind those lower front ones. That's where you can get a lot of buildup. So we want to make sure we don't miss those areas as well. And I wish he had a tongue, but he doesn't. But don't forget to brush your tongue. A lot of bacteria gets stuck on your tongue as well. Okay?
So everybody stick out your tongue. Let's see if you got any white stuff on your tongue. Because if you do, that's plaque, okay? So you gotta, every once in a while, check out your tongue. You should be brushing it every day. The other thing I want people, Pat, your tongue looked pretty good there. The other thing I want people to do is take your fingernail, go up by the gum on your front tooth, scrape a little bit off right by the gum line. Do you got any white stuff on there? If you did, you missed it when you brushed today. So you want to get up by the gum line a little bit better. That's another way to figure out if you got all the stuff off your teeth or not. Another way to find out if you got it all off after you brush, take your tongue. Rub it along all your teeth. You shouldn't feel any fuzziness. If you feel fuzziness, that's someplace where you missed. Go back and rebrush it. You don't have to have toothpaste on your toothbrush, do you, Eileen?
You do not, no.
Because what really works? Is it the toothpaste?
It's the toothbrush.
Yep, it's how you do it, not what you use, okay? So the next thing I'm gonna talk about is all the different things you can use to clean in between your teeth. Everybody knows this one, right? Floss. Now this what I'm gonna show you here, I'm gonna use my hands, but then I got some other gadgets too. Some people have a hard time, maybe because they have some arthritis in their hands that they can't use their fingers, but I'm gonna show you all the different things that I have. So if you're gonna use your fingers, you wrap the floss around your two middle fingers. And the reason why you wanna wrap it around your two middle fingers is so that your index fingers and your thumbs can move it around. Then what you're gonna do is you're gonna seesaw it till you get it between the two contacts of your teeth. Then you're gonna wrap it and you're gonna go up and down. If you don't wrap it, it can't get up in between the gum tissue and the tooth. So that's how you would floss with your fingers. Then I should have had this open, sorry. One of the things that we show you guys when you're in the, when you come to the Special Smiles event is an already rigged up flosser. They look like this. Oh yeah, Eileen, they look just like what Eileen's holding up right there, okay? I have one that's more disposable. That one you can reuse. So how you'd use this is you put it in between, same thing with the floss. You're gonna put it in between till you get through the contact. So you're gonna go back and forth to get through the contact. And once you're through the contact, then you go up and down. Some people still seesaw and you can't get as much plaque off if you keep using the back and forth motion. So you're gonna go in. And go up and down with the floss holder. Of course, I'm only doing my two front teeth so you can see it, but you gotta do all your teeth, okay? So, and some people say, well, I don't floss because I can't get it between my teeth. Well, you might not be able to get it between one or two teeth, but I bet you can get it through the rest. So even if you don't floss all of them, at least floss some of them, but it's best to floss all of them. Okay, then I got some other gadgets here. Anybody ever seen one of these? It's called a proxy brush. And these are really simple if you have a hard time flossing. This is really nice because the cover becomes the handle. And with these, this is where you go up by the gum tissue in the tooth and you go in and out with it. And you go on one side, and then you got to go on the other side. And you just use it in between all your teeth. They're so easy to use and so simple. There's even one like this where you could keep it in your pocket. It's called a soft pick. It's so small it fits where floss goes. This is a little tighter for me down here. It just slides right in. Simple, piece of cake.
Those are easy. Those are easy to use.
These are so simple. So there's really no reason why you can't clean in between your teeth. These are so easy. You can get them at Walgreens, Walmart. Well, you could get them at Shopko when Shopko is still around, but they're not around anymore. All right, one last thing. If you don't like any of those other ones, then there's these things. They're called plastic sticks. These are a name brand one, but you can get these in any, like Walgreens or Walmart too. And they're used the same way. You just put it in and go in and out, in and out. Simple, okay? Who has questions? Anybody? Yes, Pat.
Question.
There are different types of flossing tools, and the one you just hold up are for different uses.
Yes, everything that I just showed you can be used in between your teeth, and there's all different kinds. So if you don't want to use your fingers, you want to use a holder, you want to use this little brush.
Well, yeah. And
Yeah.
And also another like nasty thing that I discovered was if you go between your like teeth, you I see blood on it.
Okay. You know what? I'm really glad you brought that up, Pat, because if you're seeing bleeding, it usually means that you got a little bit of a gum infection going on. So bleeding is a sign of gingivitis or gum disease. Anybody else know what gum disease, what else they would look for if they have gum disease? Brittany?
Yeah, I actually had pregnancy gingivitis. So
Right
there was
now.
a lot of, there was a lot of swelling of the gums. So they were red and swollen.
Exactly. You get red, swelling, and bleeding. So Pat, if you continue to floss every day, that bleeding is going to go away. Usually within, 4 or 5, maybe a week. If you're doing it every day. Now, if you would brush and you see some bleeding, that could mean that you got some gum disease or that you just brushed it too hard. When Eileen had talked about brushing by the gums, you definitely want to make sure you're brushing by the gums, but not scrubbing it like you're washing the kitchen.
I once like was feeling something that tasted mostly looks exactly like what I thought it was being for real, but I'm gonna tonight, Mom, can we work on flossing? Mm-hmm. We will work on flossing, and if
perfect,
and if red shows up on the string, that means that there's I was diagnosed with gingivitis at the dentist's office because that's what causes the gums to bleed.
Okay.
Yeah. You weren't getting the bacteria off on a regular basis, and that's the key. If you do it every day, you're going to be able to get it under control. Hey, Eileen, why don't you go over the drinks you got back there?
Absolutely, I would love to do that, because even if we brush our teeth thoroughly every day and we floss, if we continue to have sugar on our teeth all day long, we can still end up with cavities. So I'm just going to talk a little bit about the different drinks I have back here. I'm hoping you can see these good on the camera, but I don't know if any of you ever drink any of these monster drinks, these energy drinks. Just in that container alone, just in this one right here, this monster drink, there are 10 teaspoons of sugar. That's a lot of sugar. 10 teaspoons just in that one can. So if you open that up and you're sipping on that all day, you have just got sugar on your teeth all day long. So acid bath for your teeth all day long. A&W root beer, that's another favorite. That has, in that little bottle, 11.2 teaspoons of sugar, just in that little container. So if we move down the list, they all have quite a bit of sugar in them. Chocolate milk, which you would think would be really super healthy for you. has less, at least 6 teaspoons, which is less than a lot of the Monster and the sodas. And chocolate milk will have some nutrition for you because it has some protein in it. So that's better, a better choice than, say, the Monster or the root beer. Orange juice, again, you know, everybody says, well, we got to drink some juice because that's really healthy. Well, it is healthier than soda, but that container of orange juice has 11 teaspoons of sugar in it. That's a lot of sugar. You would never sit down with a bowl and eat 11 teaspoons of sugar, I don't think. I know I wouldn't. So that's what we're putting in when we drink that. So we just have to be cautious, you know, maybe have a little bit of orange juice, then make sure afterwards you brush your teeth or swish with some water, because that's going to swish away some of that sugar that's not sitting on your teeth. Gatorade, they say is so good for us. It really isn't. Gatorade has 8.5 teaspoons of sugar. And if that's supposed to be healthy for us, it really isn't. Mountain Dew is another one. That seems to be a big favorite. That even had a syndrome named after it. It's called dew mouth. That little can of soda has 11 teaspoons of sugar.
That's like a quarter cup of sugar.
That is a lot of sugar. But then we have the star here in the middle, our water. That has no sugar in it. So we should try to go heavy on the water and maybe occasional on the others. Have the sodas for a treat, have the juice for a treat. We can have chocolate milk with our meals every now and again, but just try to make water your go-to drink and make the other ones be a special treat.
There's a saying, sip all day, get decay.
That's right.
So if you're drinking soda all day long or something with a bunch of sugar in it, you're gonna get cavities if you're not taking care of your teeth. And even if you are taking care of your teeth, you'll still get cavities if you're sipping on soda all day long or juice. Yes, Pat.
So I've heard some people drinking sugary stuff like the Gatorade and stuff like that. They normally brush their teeth right after they drink something sugary.
That's good, but
and
some people aren't in a position to brush right away. So rinsing with some water would be okay too.
I drink water. I drink something called LaCroix. That's a natural carbonated water. Some type of a. It's not necessarily a soda. It's like kind of like a. It's kind of like a copy of soda. It tastes like soda.
That would be something good to research and see how much. If it doesn't have any sugar in it, that's good. But
it doesn't have any sugar in it. Just it says carbonated. It says. Can I get the ingredients?
Sparkling water, I believe.
It just
says sparkling water.
Just says sparkling water, natural flavoring. That's all it says. No grams whatsoever.
Good. How about anybody else? Does anybody else have anything they want to add? Looks like Rebecca's mom's trying to say something.
Hear me?
Yep.
Okay. She does like to drink soda, but I don't give her any sugared soda. But when she does get it, it's diet. Does she need to brush her teeth after diet?
Great question.
Being a cola, I know a dark cola can stain, but
Eileen, do you want to answer that?
Does the soda itself do something to your teeth, like damage it? Even without the sugar, I mean?
They've done a lot of studies on the diet sodas and find that, well, you mentioned the stain, there is still a lot of acid, even though it's a diet.
Number 41.
So the recommendation really is to limit the diet sodas too. Again, it goes back to everything in moderation. So if we have a diet soda occasionally, that's great, but we should really always try to stick with, make water our go-to.
Yeah.
Okay.
The other thing too is even if it has carbonation in it, the acid is included in that carbonated drink. So
Exactly.
you know, you talk about the LaCroix, Pat, and that's fine. It doesn't have sugar in it, but because there's carbonation in that drink, there's still a lot of acid. And one way to find out is to, I guess, look at the ingredients, you know, even though it says it's sparkling water with no sugar, see if there's anything in there that says some form of acid, because they need that to make carbonation. So.
Okay, thank you.
Mm-hmm.
It looks like Kathy has her hand up.
Clara?
Yeah, I have a question about teeth, but my question is I usually do medicine with juice, and I'm trying to figure out how I can take my medicine with orange juice.
Or without orange juice? Or without it?
How I'm gonna drink orange juice without orange juice, because I take medicine with it. That's the question.
Can you take your medicine with water, or do you use the orange juice to kind of cover the flavor of the medicine?
I don't know. I just always do, but
I don't know that because I always do.
You just always take it with juice? Why don't you try next time taking it with some water? And just see if you can tolerate the taste.
Or if after, you know, if that doesn't work for you, try it with the water first, Kathy. And then if that doesn't seem to work, use the orange juice, but then rinse your mouth or brush your teeth. Rinse your mouth with water or brush your teeth right afterwards, so that that acid and the sugar isn't sitting on your teeth.
One other thing you could try, if you don't want to go all of a sudden to water because that's so different for you, is do half water, half orange juice together. So you're diluting your orange juice. And then over time, you can just have more water than orange juice, and eventually you'll be to all water, and it won't be such a hard transition to make for you. You could try that.
Yeah, I might try what you're talking about.
Yeah.
I might try to put water in the orange juice, and I can feel like what's it gonna taste like.
Mm-hmm. And just slowly add more water every day, and then it won't be orange juice.
Yeah, because that's the question. Because the question is the question was usually I get up in the morning and I come down and get my orange juice and put water in it.
okay.
And I might try to just put water in the orange juice, and I can just take it from that with my medicine.
Thank you.
Sounds like a plan.
Okay.
Sharri and Eileen, I have a question about mouthwash, and if you recommend that or not, or what, I don't know. I know that's not talked about very much, and some people like it and some people don't.
Go ahead, Eileen.
Well, I don't necessarily always recommend mouthwash. They haven't found a lot of value. If you're brushing and flossing as you should, you're doing what you need to do. A lot of people like mouthwash because they like the taste and it will freshen their breath. So I'm
not a big advocate on brushing or using mouthwash either, because people have a tendency to, you know, some of the commercials say, you know, Listerine kills bacteria. Yes, it kills very little. It only gets rid of the loose stuff. It doesn't get the stuff that's stuck on your teeth. And the only thing that can get that off is brushing and flossing, or using something to clean in between your teeth. And people, they hear those things about how it kills bacteria, so they start brushing, or they start rinsing with mouthwash, and they stop brushing and flossing. I had a patient who did that, you know. He's like, well, I saw on TV that it helps, you know, Listerine helps kill bacteria. Okay, so what are you doing? Well, now I'm just rinsing with mouthwash. And he had a lot of bad stuff going on in his mouth very quickly. So Do we have some
Thank you.
chats going on there, Jason?
Yeah, I just was looking at the chat, and there is a great suggestion. Kathy, for your medicine, someone suggested maybe trying flavored water without sugar too is another option when you're trying to get off the orange juice.
Great suggestion.
And Don really likes his mouthwash because it makes him feel minty. But, you know, as long as you're still brushing and flossing.
Yeah, you got to, what I tell people is brush, floss, and then use the mouthwash, but don't just use the mouth. Oh, I'm sorry. My dog is like growling and I'm like, what's going on? There's another dog out there. But just don't use the mouthwash. You got to still brush and floss or use something to clean in between your teeth.
Does anyone have any other questions? You have Sharri and Eileen, these specialists with oral health that can help you out if you have any. I have a question, if you guys can raise your hand. Does everyone have a local dentist? Everybody have a dentist? Okay, I'm gonna put up a screen. I'm gonna see if I can get back to screen sharing. If for some reason you do not have a local dentist, I would love to help you find one. So that's my contact information. So you can email me if you're looking for a dentist. We are hoping to offer a free dental day once we're able to see each other again in late summer or early fall. The date hasn't been set yet, but one of our other great clinical directors, Dr. Rob, is going to have it in his clinic. So if you need help getting some treatment, make sure you reach out to me because I can help you get that.
Oh, glad to hear that, Chelsea, that your mouth is feeling better. I'm glad to hear that.
All right, any last questions before we wrap up our show today? Well, I want to thank Sharri and Eileen for sharing their expertise. I also really want to talk up our Special Smiles program. We really would love to see all of you there in any of our healthy athlete disciplines we offer. Know that when we're back together and we do start offering things again, that you don't have to be competing at that state games or the event that we're offering healthy athletes. Know that if you can get there and have a caregiver or a friend or someone bring you, you're still welcome to come to Healthy Athletes. And it's kind of fun to come to a competition and watch people when you're not competing and hang out at Healthy Athletes. So we look forward to seeing you. And I will send an email back to all of you with some of the slides that show the flossing and brushing techniques. And then I also have a caregiver's guide to oral health that I'm going to share in an email that you can make sure maybe your mom or dad or a caregiver that helps you out, you can share that with them. It has some good tips for proper techniques. So thank you.
Thanks. Good to see everybody.
Bye.
See you on the next show.
Have a good day.